Hey, happy Valentine's Day. This is the day where we want to love on all of our people. We want to give from the heart. Listen, it has already started for me. People have already come by and given me great gifts and stuff like that. And as you can see, there's some cute little hearts on it. And that's what we're going to talk about today. We are going to talk about one of the biggest issues that affect your heart, and that is cardiovascular disease. It is the leading cause, meaning that it is number one, the leading cause of death in men and women. But the way that it presents itself is a little bit different in each one. So you want to make sure that you watch until the end so that way you can know, okay, in men it may show up like this, but in women it might be a little bit different. So, but at the end of the day, my job and my goal is to help you protect your heart so you can continue to share the love and be able to love on your people, right? If you are new here, thank you for joining. If you have been watching and you continue to watch, thank you, and welcome. I am Dr. Ashley Booth. I am a board certified family medicine physician, and I provide practical health tips and tools that you can use in your everyday life. Now, before we get into it, I want you guys to show me some love. And all you have to do is subscribe if you haven't already done so, follow, share, tell the people that we are on, give us a thumbs up. It's very simple. What it does is it continues to let you know that we are out here and doing the things, but it also lets other people know so that they can be informed as well and get some credible information. So we want to debunk a lot of the things, okay? So just do that for me and give me some love today on Valentine's Day. Thank you so much. Now let's get into it. So cardiovascular disease, as I said, number one killer of men and women. But what the heck is it? You hear this big old word, you have cardiovascular. Cardio basically means your heart, vascular means like your blood vessels. So it's essentially a disease that is going to affect your heart and your blood vessels. And that can be a lot of things. That's talking about stroke and peripheral vascular disease and blah, 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 all these different things. What we're going to focus on today is heart disease, because heart disease is under that umbrella. And let's just talk about the heart and the blood vessels that specifically come from the heart, and those are coronary artery disease. Big words that just basically say these are the blood vessels that belong to the heart. We're not going to get too deep into it, okay? And one of the things that happens is one of the biggest issues with it is cholesterol. That's with the coronary artery disease. You have this cholesterol, and that cholesterol can form a plaque. So it just kind of sits on there. You build up too much in there. What's going to happen is that blood vessel that was open like this, because of all that plaque and stuff that deposited in there, it's kind of like the pipes at your house and the drains. And if you let the water out, water goes down fine, right? But then if stuff starts to continue to build up, water's not going down as fast as it used to, because all this stuff is built up on it, has gunked it up. And you're like, oh my gosh. So that's what happens with your blood vessels, and it decreases the ability of the blood to flow there. You can also have some clots that break off and go and travel to that area as well. Again, decreasing the blood flow. And what happens at the end of both of them is you're going to start experiencing pain. Now, let's talk about some of these symptoms, because you have some gradual symptoms, and these are some of those things that are going to give you a little warning and say something's not right. You probably should go get it checked out. So, some of the things that can gradually happen over time is you can have a little bit of a chest pain and then it goes away. You can have a little bit of chest pain and it goes away. It's an indicator that we need to get it checked out. You can also have palpitations. The heart is beating funny, it's beating fast, it's beating kind of weird, it doesn't quite make sense. That could be an indication. Shortness of breath. Over time, you just feel like I can't walk as far as I used to. I can't do the things as well as I used to. I'm getting short of breath. I used to be able to walk from a car into the office without a problem. And now I'm like noticing that I can't really do that as much, or walking around the house, whatever it is, you're noticing that the distances that you used to travel, you're not able to do that over time. It's slowly increasing how well you're able to do that. The other things that you can start noticing is swelling in your legs. It starts a little bit, goes away, starts a little bit. So these are some of those things that could be indicators and gradual symptoms of your heart disease. Now, when we get into those sudden symptoms, the one that we're talking about is when you are experiencing a heart attack. Okay. And that one is you have shortness of breath that comes on like that. Like you were fine, and then all of a sudden feel like something took your breath away and you can't catch it. You also have some of that pressure, especially in the center of your chest. Some people say it feels like an elephant is sitting on you, this pressure or pain. The other thing is some people say they have like a pain that radiates to their jaw, things like that, or down their arm. Those are some other symptoms that kind of come on suddenly. Now, for women, they have all of those symptoms. You can have those, but because we're women, things show up a little bit differently. And you can have like some fatigue. You all of a sudden say, I just feel really tired. Not my everyday tired. This is a different type of tired, right? And again, it's really sudden. All of a sudden, you feel tired. You have some nausea. You feel like you have some indigestion, need to burp, or feel like, I got a little gas and it just won't let up. You could faint or you feel lightheaded. Those are all some different symptoms that women start to experience. And again, every time you experience it is not necessarily it. But women, like I said, when I did the title of this, Listen to Your Heart, once you listen to your heart, and I also want you to listen to your gut. Because if you start feeling that, you say, this fatigue is different. This me feeling really tired is different than normal. You want to go ahead and get that checked out. Now, there are some risk factors for this, and one of the main ones is high blood pressure. That is the number one risk factor for African American women is high blood pressure. And African American women had the highest rate of death due to heart disease, and they were 60% more likely to have high blood pressure than white women. So, high blood pressure is super high on the list. If you have been diagnosed with high blood pressure, you think your blood pressure has been elevated, know that over time, that can contribute and lead to this heart disease, which can be the number one killer for you. So you want to make sure that you have that under control. The next one, the second risk factor is diabetes. Diabetes is basically, like I always tell you, is sugar, excess sugar in your tank, excess sugar in your bloodstream. It is going around, it is doing a lot of damage, and it's clogging things up. Once that happens, that leads to inflammation. It's traveling through the bloodstream, so it's damaging those blood vessels. The other thing that it can lead to is high blood pressure. And we said that high blood pressure was the number one risk factor that can lead to heart disease. So making sure that the diabetes is where it needs to be, because diabetes can also lead to that high blood pressure, and that high blood pressure can cause your heart disease. The other one is cholesterol, having really high cholesterol. That cholesterol, like I talked about earlier, can travel around those blood vessels, deposit in the heart, make it difficult for the heart to continue to get the blood out like it needs to. It can also start to help those blood vessels, and not help. I don't really want it to help that, but it can make them like kind of get stiff and hard. So you don't want that. So you want to make sure that you keep those under control, because the high cholesterol can affect those. Being overweight. And I know this is a tough topic. It is a sensitive topic. This is one of those that we just have to kind of see where we are and work on the things that we can to get it down. But we do know, because excess weight leads to excess fat, and that fat leads to some extra work and stuff that you have to do to get your body moving, and that causes stress on the heart. So that is kind of a roundabout way of what that is doing for you. So we have to work on that. Smoking. Smoking significantly increases your risk of high blood pressure. It increases your risk of heart disease. I've noticed, and we noticed through journals, that if you stop, then it significantly decreases like how this is going to affect you over time. So if you are smoking, you want to make sure you definitely start working on trying to cut back, trying to quit, so that you don't have that risk of a heart attack. The other one is dental hygiene. And I know this one is one of those weird ones that's out there. People are like, dental hygiene, what my teeth got to do with a healthy heart, right? Healthy teeth, healthy heart. But there are some studies that are out there that says that When your teeth are not healthy and your gums and stuff are not healthy, that can affect your blood vessels. And then that can lead to some heart disease. The other thing is, if you have bacteria that is in your body, that's in your mouth, it can travel to the blood vessels in your heart and it can weaken those valves and stuff that are in your heart. So you want to make sure that you go to your dentist and you see them regularly. Now they are still trying to figure out exactly the direct correlation with it. Like, why? How does this work? But there are more studies that are being done that says that when we look at our dental health, there is somewhat of a correlation between that and our heart health. So you want to make sure that you are up to date on that. So how do we prevent it? And I've talked about a few ways to prevent it. The main thing is keeping our risk factors at bay. So if you have high blood pressure, diabetes, cholesterol, obesity, smoking, any of those risk factors, you want to make sure you do everything that you can to get them under control. And here's how you can do that. Exercise. I know we talk about it. A lot of people say, I don't have the time. Quite frankly, you have to make time because you don't have time for a heart attack. That's one thing I say. You don't have time for a heart attack because one of the things that it is going to do, it is automatically going to make you leave. If you survive it, it's going to make you leave that hospital with about 4 to 5 different medications. It automatically buys you that. So you have to figure out how you can make time. And this is how you can do it. There's some studies that have come out. We want you to do 30 minutes a day, 5 days a week. And I say we, but that's what it says to show you to get you the results. 30 minutes a day, 5 days a week. You say, I don't have 30 minutes at a time. That's all right. I got you. They have noticed that if you do 10-minute intervals, if you do a dedicated 10 minutes brisk walking for 10 minutes 3 times a day, and you're able to get your 30 minutes in, that will help. And what does that look like? That looks like you can talk, but you can't sing. And not talk like, yeah, girl. It's like, yeah, uh-huh. So you're getting your heart rate up and stuff like that. So you can talk, but that person, especially if you're on the phone, they're probably going to say, girl, call me back because I don't want to listen to you huffing and puffing while you're trying to do it. But it is brisk activity. A lot of people say that they exercise because they do a little bit of walking and stuff at work, but it's that brisk that really gets your heart flowing, gets it pumping, gets things moving, and that is going to help to decrease your blood pressure and get things looking better. So give me 3 tens a day. Okay, so give me 10. Just give me 3 10-minute intervals a day to get your 30 minutes in, and I know you can do it. The other one is diet, making sure that it is full of your green leafy stuff. It has some lean meats if you are into meat, protein, full of protein, and decrease your carbohydrates like your sugary stuff, your starchy stuff, the things that we like love and crave. But we want to decrease that. And so you want to make sure that your plate looks very beautiful, very diverse. So that way you can help while you're doing these things. Because once you do the exercise and the diet, the third piece is weight loss. Usually if you exercise and you diet, the weight loss is going to be like the return on that investment, right? So that's what you're going to start to get. So if we start doing that, we're starting to get the things under control, and that's going to help to control the diabetes, the high blood pressure, the cholesterol, all of that. The other one that we don't talk a lot about that we need to is stress. And I mentioned this earlier when I was doing some of my other little short clips and videos, but you are too blessed to be stressed. And there are a lot of studies that are showing that stress contributes to a lot of these different things. Stress can cause you to have high blood pressure. Again, that's leading to the heart disease. Stress can also lead to holding on to weight and increasing your cortisol levels. That can lead to diabetes. Stress is doing it. You do not want to be stressed out. You don't want to have to deal with all of those things and the repercussions of what stress can do. So then what you want to do is just make sure that you manage it. Figure out what you can do. What are your triggers? What are your issues? And do those things so that you can get it under control. So that way you don't have to deal with all of these issues that come along with it. Okay? So at the end of the day, I want you to listen to your heart. What is your heart telling you? Like I said, it can tell you some things. It can beat funny. It's like, something's not right. It can give you a little bit of pain, especially with those gradual symptoms. You want to listen to it. Women, you want to listen to your gut, your intuition that says something is not right. I don't know what this is. This is different. You want to make sure that you get it checked out. So make sure that you go to your doctor, you express and talk to them about your concerns. You want to make sure that you keep your appointments. If you are diagnosed with any of these things, high blood pressure, diabetes, all of that, make sure that you are taking your medicines. If you feel like, I don't know if I should be on this, I don't know if I want to take it, have that conversation with your doctor so they can tell you the pros and cons of doing it, what can happen, all of that. Build that relationship so that you can do that, because at the end of the day, you want to make sure that you are well and you want to protect your heart. If you have not found the provider that you're looking for, if you're still looking for somebody, you know that checkup is long overdue. Well, you guys can come and join us. We are still accepting new patients. You can give us a phone call. You can go to our website, it's all listed there. And we would love to serve you because we want to make sure that you have a healthy heart so that you can continue to share and spread the love with others. Until next time, we will see you soon and take care.